Hi, folks. Thanks for joining NGA for this briefing on COVID-19 vaccine administration and corrections. We have a packed slate of briefers today, so let's get started. Our first briefers represent the American Correctional Association, the oldest association developed specifically for practitioners in the correctional profession. Representing ACA on the call today are Tony Parker, President-elect of ACA and the Commissioner of the Tennessee Department of Corrections, and Dr. Harbin Steele, Chair of the Coalition of Correctional Health Authorities and the Health Authority for the Nebraska Department of Corrections. Commissioner Parker, Dr. Deal, the floor is yours.
Thanks, everyone. Thanks for allowing ACA the opportunity to be here today and share our thoughts about this important topic. If you will allow me, first I'd like to say a few words about the American Correctional Association and how the work that has been carried out for over 151 years has really provided a framework with protocols and expected practices that can help any agency with executing and delivering an immunization plan for COVID-19. I'd like to speak from the perspective of my time as a warden and also as commissioner, because I can unequivocally tell you that the expected practices, and I still call them standards, but the expected practices of ACA that are required when implemented form the foundation for a sound correctional system. I know wardens and correctional administrators will tell you one of the most important responsibilities that we have centers around ensuring individuals who reside within our custody have access to adequate health care. Areas such as access to health care, as well as staff and offender wellness, are clearly defined in the expected practices of ACA, and that really have become policy in many correctional departments throughout the country. Communicable diseases and infection control programs, as well as immunization planning, are all clearly defined within these expected practices that, again, have become the standard operating procedures in many states. ACA's 5th edition mandatory expected practices require specific, timely testing of our inmate populations, verification of immunization records, immediate access to health care services upon intake. These practices not only helps the administration ensure an adequate level of health care delivery, as most everyone know in corrections, they also protect us from litigation. A critical point I guess I'd like to make, and I guess I could call it an observation rather than a point, is I think in many cases, I'm not sure the public as well as some decision makers truly understand the capabilities of correctional healthcare systems in many of our states. Again, when it comes to vaccine distribution, I believe any nationally accredited corrections agency or an agency that follows the expected practices that I've discussed can effectively, efficiently, and professionally carry out an immunization plan for COVID-19. Not only provide immunizations for our population, but also for our frontline correctional employees. And I can't stress this point enough. Getting our staff vaccinated is critical in slowing the spread of COVID-19. ACA has a public policy statement related to employee wellness. And our employees work in a very stressful environment. I'll talk more about providing employees an opportunity for vaccinations on the job later on. But I do see this, being able to provide these vaccinations at work, on the job site, as being a big benefit to the staff. So as an administrator, I just want to say, I have comfort in knowing that we have existing policy and protocols that are grounded in the expected practices that I mentioned previously. And keep this point in mind, immunization planning and delivering large-scale vaccination plans is not really a new concept to corrections, just as Dr. Deal just mentioned. Some of you may remember, as Dr. Deal mentioned, corrections years ago worked with the federal government, CDC, to vaccinate our inmate populations for hepatitis A and B. Corrections was very successful in completing this catch-up program for our inmates. Every year, we successfully immunize our inmates in our facilities against influenza. Again, just another example of providing such services, as well as demonstrating our continued standard, our community standard of care that we offer in corrections. Our healthcare teams remain in communications with local health authorities as well as the CDC. In Tennessee, the Tennessee Department of Corrections just completed multiple tabletop exercises with TEMA, with the state health authorities and others to test capacity, to test equipment and logistics as we prepare to receive vaccines at our facilities that will be provided to both our staff and our inmates. Again, providing COVID-19 vaccines to our staff and inmates is critical in slowing the spread of COVID-19, especially our staff. When you consider they enter and exit the correctional environment on a daily basis, transitioning into and out of our communities, which in and of itself presents a unique challenge in preventing the transmission of the virus. You know, I've heard many people say that in some of our prisons, they consider them a primary source of the spread of COVID-19 in some locations, but I know through contact tracing in a lot of cases, the individuals who enter the exits our gates each day significantly contribute to the spread of that virus, and we have to get in front of that. We're providing the vaccine to staff and inmates based on a tiered system that prioritizes those at most risk, much like what you see in a lot of states and has been recommended by the CDC and others, starting with our medical staff, those staff that are 65 years and older, staff with comorbidities, staff that work in isolation or quarantine units within our facilities. I believe in offering our staff the opportunity to receive the vaccines on duty at the work location will also result in a higher percentage of participation. Now, guys, think about it. The time that we're asking our frontline staff to work in most states these days is a big ask. Let's be honest. Most are working overtime on a regular, if not a daily basis. And most of our staff have shared with me that the opportunity to get vaccinated at work versus the time it takes and the trouble in scheduling an appointment with a local health department or others is a great benefit. And again, I believe as commissioner that in Tennessee, we will see a much higher participation rate by being able to offer that vaccination there at the facility. So I just want to give the American Correctional Association stands ready to assist in any way. I encourage you to take these names and email addresses down. ACA's Executive Director, Mr. James Gondles, the Deputy Executive Director, Mr. Jeff Washington, our Senior Director of ACA's Office of Correctional Health, Dr. Elizabeth Gondles, and the Director of ACA's Office of Correctional Health, Mr. Mike Miskell. We stand ready in any way to assist in any way with this process.
Well, Commissioner Parker and Dr. Deal, thank you so much for everything that you're doing in this space and for the offers of support that you've provided to this community of professionals.